Thank you. And thank you, Kate, for guiding me down and up here and waiting for the slides. She's a very patient person, so thank you. Thank you all for making time in your day to come out to hear some of the things I have to say. I've been fortunate over the last several years to kind of expand my experience in collaborative efforts with individuals at CMC, which were treatment providers down in New York City, colleagues at Columbia, and colleagues at the Partnership for Drug-Free.org. A lot of my career and a lot of my work initially was just working with individuals struggling with addiction and trying to help them make important changes in their lives. And over the years, I've come to contact with family members. And a lot of the things I'll be talking about today really is about the work I've been doing, going into communities and working directly with parents and loved ones who have someone in their family that's struggling with addiction, because they're often, and they'll tell me, the ones that kind of live in a world of isolation and anxiety and concern and struggle with how to be helpful to their loved ones and receive a lot of different messages about how to go about doing that. So we've been trying to go around the country and develop a parent-to-parent support network in which parents who have traveled down that road are there and available to talk to other parents who find themselves on that path. And not only provide the well-earned wisdom and experience that they've earned by going down that road, but also to bring them into contact with evidence-based strategies that they can also offer other parents as a way to help make changes. And as Dr. Savage kind of pointed out, in hers, when we look at treatment outcome, one of the indicators of poor treatment outcome is low family support. So family can be a really, really important context and is in the process of change. So I hope to be able to just go through and show you what we're kind of developing and bringing together, give you an idea of where these resources are, and hopefully you'll find it useful in your work professionally, or if, as we all know, living in communities can come across individuals who are struggling with loved ones, that this can be a set of resources for them. I want to apologize in advance for my Queens accent. So I've been told and asked what country I'm from at times when I'm traveling around. It's Queens, New York, that's where it came from, so bear with me if my pronunciation is a little off today. I'm also going to be navigating glasses and remote mics. I'm a little out of my league here, so bear with me. We all like to kind of cite statistics. I'll just go through these briefly. I don't want to crush you with PowerPoint. I probably have too many slides here to cover. I really was thinking that if you access the slides after the talk, you'll have a wealth of information to follow. So I'll be jumping around a little bit and hopefully make this interactive in a way. I'll also be showing some videos from parents that have been part of our parent support network, and they'll talk about just the skills that they're using. What's kind of neat about that is it's coming from their own personal experience, and also the impact it's had on their loved ones. They've all given permission. These videos are used with our work with the partnership, so there's no confidentiality issue there. We've been given waiver. Just briefly, you'll see all these stats probably throughout the day. Past year drug use, if we note just on a national level, is fairly prevalent. It's not an issue that's low. Many people are using substances. Even if we go down to our early adolescence and young adulthood, you can see that prevalence estimates are notable on the population level, with marijuana still kind of being the most prevalent that is out there. Alcohol is not on there. If we put alcohol and nicotine, certainly they are also very prevalent. So really the take-home message is, on a population level, this is a very notable phenomenon. If we just look at some statistics to your own state of Maine, and we think about just initiation rates, and this is over the last 5 years, Generally, initiation in early adolescence, between 12 and 17-year-old, is again notable. If we think about the prevalence of schizophrenia as 1% in the population, and we start looking at prevalence rates of 15, 20, 30%, it certainly speaks to the magnitude of that. And in Maine, among young adolescents, initiation for alcohol, marijuana, and tobacco is still very notable. So these are just individuals that are stepping into this world for the first time, and it's a notable percentage. If we start looking at disordered use, not just use, we can see again high prevalence rates, still clustered around alcohol and nicotine, and marijuana are also spiking, but notable percentages. This is not an issue that's unknown. It's an issue that strikes a lot of individuals across the age range, and certainly peaks in early adulthood, and can impact, a notable amount of people, not only for the ones struggling with it, but for families. On this particular slide, and the next couple of slides I find really interesting as a treatment provider. On the one hand, people seeking treatment, those with a drug use disorder, are more likely to enter the treatment system than an alcohol use disorder. And the blue bar is drug use or disorder, and the pink bar is alcohol. And when we look at the types of treatments that's sought out, any treatment is combining all the groups, but you look at physicians being probably a point of entry for a lot, particularly for drug use disorders. So it's not a specialty, it's frontline clinicians that are going to come into contact with this. And even as Dr. Savage was pointing in her other slide, that having the ability to assess this in primary care and other frontline physician interactions is really important, because that's usually where it may be showing up first. The other kind of discouraging thing is if we look along the y-axis, we're talking about percentages of 0 to 15%. So if we flip it and we say, of all the individuals in the general population who have a substance use disorder, how many are actually coming into the treatment system? Well, this is the percentage of people who are not coming into the treatment system by age. And this is always humbling and sobering for me as a clinician. Work in a drug use treatment system, and we run clinical trials. And I know I see probably, at most, we see 10% of the people that are struggling with a substance use disorder. About 90% of the people that meet criteria for a substance use disorder in the general population never come into contact with the treatment system. Right? So it's a real small percentage that we're actually able to, one, meet, and then two, when we all talk about evidence-based treatments, not everybody who even enters the treatment system comes into contact with that. So there's a lot of room for thinking creatively about how we can get all this information and help out there into the hands of the people that need it, because we've got a long way to go. If you ask people why they're not seeking help, certainly a certain percentage will say it's because of costs, and it's not cheap, and I've known a lot of families who've had to mortgage houses and other things to get their kids through rehab and loved ones, so cost is an issue. But one of the biggest percentage of why people aren't seeking help is because they're not ready to stop using. They haven't totally thought this is the thing they want to change, which is really important, because sometimes the person struggling here is going to be the last person to see the need to make changes. So it's the loved ones that are around them that are seeing the damage and the struggle, and the ones that are noting that things aren't going right much earlier than the individual struggling. So that leads to kind of the issue of collateral damage, which is families here. Very few people enter the treatment system. People that are using and are struggling with the disorder are not as likely to seek treatment because they're not ready to make change, and certainly the problems arise much early in the trajectory. So we have the families that are kind of stuck in a context of seeing this, not knowing necessarily what to do, what to make of it, and sometimes operating in the dark. And that is for every one individual who is struggling with a substance use disorder. There's certainly many more family members that are affected by this or impacted by this. It can increase financial problems, stress, psychological and social functioning for family members, create a huge sense of isolation, and families also tend to go underground around this. You know, there are a lot of situations, if a child or a loved one had cancer or other chronic health conditions, families might be much more open to talking about that and getting support. But when we get to the chronic condition of substance use disorder, most often than not, families shut down and kind of go into hiding. And what's out there for families when they're struggling with this? A lot of different messages. I'm not here to bash any particular message. And one thing I'll talk about is there are many roads to change, and that message that there are many roads to change can be very empowering and helpful for families to hear. But certainly families that we've worked with will come back and tell us, you know what, yeah, we get a lot of advice from people. Some of that advice is you need to use tough love. You know what, you can't do anything here. You can't change someone. You know, you really have to just move away. This person won't change until they hit rock bottom. Be careful not to enable. Right? This person's an addict. Don't believe anything they say. It's all lies. If you do want to help and you want to be part of the solution, you're codependent. You know what? All addicts are the same. So these are some of the messages that families get and struggle with and hear. And again, I think they come from helpful places. There's it resonates. There's some wisdom here. But there can be a lot of competing message, and families are often confused and left in the dark. So what do we know about motivation? What's some of the myths that are out there? One of the myths is that confrontation breaks through denial and makes people change. So confrontation has been a strategy that is used quite often, has a long history in the treatment of substance use disorders. Bill Miller and William White have a nice article in a Counselor magazine on confrontation, the historical use of it, and the evidence that supports or doesn't support it. Other myths about motivation is it usually takes a crisis of hitting bottom for someone to become motivated to change. And that motivation is kind of like a switch. At some breaking point, a switch is thrown and the person's ready to change. But until that happens, there's really nothing you can really do. All right, so what are some of the typical recommendations families may get? For the person with the problem, say no, just stop it already. Go to 12-step meetings, which again can be very supportive. But you need to go to a 12-step meeting and you need to go to rehab. Again, if we think about rehab as a suggestion, 1 out of 10 people meet the treatment system that have a substance use disorder. For those that are concerned about them, there are support groups, so they may be told to go to Al-Anon or Nar-Anon. What you really need to do here is do an intervention, or you need to let them hit rock bottom. It's the only way they're going to change. Okay? So these are the messages often that families receive. And in working with parents, being asked to let their kid hit rock bottom can be an extremely painful and confusing and difficult situation to do. It goes against the instinct of what being a loved one is all about. So families can really struggle with that dilemma. What do I do with this message? Okay. But what is some of the empirical evidence around motivation? Well, the empirical evidence suggests that confrontation actually works in the opposite. When you use harsh confrontation models, what we often find out is people are less likely to want to make change and kind of pull back and avoid. Bill Miller and a large kind of empirical analysis of confrontational methods really has showed there's been no effectiveness. There's no empirical data to show that confrontation leads to change. It's just not there. We know that motivational shifts can occur whenever the cost of behavior outweighs the benefits. So motivation is a fluctuation. Right? There are things that people are attached to, just as we said and looked at that slide. People get something out of using substances. And Dr. Savage kind of talked about the neurobiology of reinforcement and pleasure. There are reasons why people use and they hold on to that. And there's also a tax and a cost for holding on to that. So we know that shifts can occur and motivation is a dynamic process. Motivation is highly sensitive to social interactions, which is a really useful thing. It's not a static entity. It shifts. People become more or less motivated in social interactions and contexts. Motivational interviewing, which I know other talkers will touch base on today, is really using that set of lenses to understand motivation and helping counselors interact in a way that can increase or grow it. We know that when people have choice, we're more likely to get buy-in. So not having one answer or one particular path, but having numerous different paths can help people engage in treatment and the change process earlier. And we know that labels don't help, and that often we can argue over weeks and months about labels, but doesn't necessarily mean someone's going to step into the change process. So where I'm going today is what happens if we step away from just some of the myths around motivation. What is available to families when they want to step in and try to help their loved ones and also help themselves? Because it can be a very helpful way to create a context to increase the probability that people seek help. And when people seek help, it increases the probability that they're more likely to stay engaged and make changes. And that's kind of what this tour will be about today, and providing you with resources so that in your own work, in your own travels and discussions, you can offer some of this and help guide people to the resources that are out there. I'm going to just play a video that we put together, and I just want to ask you, see what shows up for yourself. When you see these words come up and you see what goes on, what's your mind doing with this? How do you feel? There's a lot of words that we use to describe the struggles that people have and describe the situations that we deal with as practitioners. I don't know what your reactions were to the two groups or set of words that are out there that we use in our conversations with the person struggling and with family members. I know in my work with parents who have lost kids, have kids struggling with it, those first set of words, they often talk about how angry they feel when they see those words, how upsetting it is to see those words, how handcuffing it is. So what I hope and what we're working with in our colleagues is to try to change the conversation, try to change that there are different options, there is hope here, people do make change, and as a group, that's why we're all here. And that the approach and the context we can set can be inspiring and help people move forward, or we can get caught in words and labels that don't necessarily help promote that goal. So I'm going to kind of go through this idea of changing the conversation. I want to touch on 4 buckets that we really, so this is my kind of technology. I like to move, I get antsy, and I have this, so I'm hoping it's not going to feed back on that. There's 4 ways we're going to be talking about just helping. Helping with understanding, helping with self-care, helping with words, and helping with actions. This is kind of the way we've broken down this particular model. Each is kind of coming from an evidence-based perspective, which I'll touch upon. Each can be important with family members. It gives family members something that they can suggest and do and implement, and increase the chances that their loved one will make a change. Okay? The power of this program, the power of all this evidence-based perspective is we like to get micro and we can analyze things in small ways. But what I'm really talking about is a contextual look. To the extent that we can change the broader context in which the individual struggling with substances is making their decisions, the better we are and the more effective we can be. So all of these as a group is where the power of this model comes in. Certain aspects can be helpful, but I just ask people to think about all of this stuff kind of going on at the same time as family members roll it out. The fundamental tenets of this perspective is just asking people and helping with understanding. We try to give them a new set of lenses to help them see when they're looking at the struggles someone's having, how do they try to make sense of it? I think as all of us in the field, people want to come and really in a sense are asking us, help me understand what I'm seeing. It's not making sense. Can you give me a language and a set of lenses to try to make sense of that? And there are a lot of them out there. So again, we're coming from the perspective is we're offering just one set of lenses. I'm not going to say it's truth. It is based on evidence, but from a more pragmatic perspective, which is if you look at your loved one's behaviors this way, it may open some doors and some possibilities that weren't there for you beforehand. It does talk about staying involved and connected to struggling loved ones. A little different than the message of detachment. We'll be talking about some of the behavioral principles and change. Detachment, and for sometimes family members have to move back. You know, there's a time maybe when they can't, but the power of this model is really about staying connected to your loved one, and that's often very empowering to parents and loved ones because that feels natural. I want to help. I want to still be part of the process of change. An important message is also helping loved ones take care of themselves. There's that old adage, I'll get back, when an oxygen mask drops, I just heard it on the plane last night, you got to put it on yourself before you're supposed to then turn around and put it on your loved one. Self-care, which often falls by the wayside for family members because they are consumed by crises and on edge, and I've also heard if they are taking care of themselves, there's a lot of stigma out there that they're not paying attention to the problem. So again, a lot of mixed messages that can just burn families out. And in the process of taking care of themselves, we really talk about effective tools and strategies that they can put in to help make and promote behavior change. You'll get a taste of 2 particular evidence-based principles that are really blended here, or programs. One is CRAFT, and I'm curious, how many people have heard of CRAFT? Oh, that's awesome. Sometimes I go some places and there's no hands being raised. First CRAFT study came out in 1999. It's been out there a long time by Bob Myers out of New Mexico. Bob Myers is very open about growing up in a household where his father had a significant drinking problem. And he saw the toll it took on his mother, and he saw the toll it took on his family, and it made a significant impression on him. So as a psychologist and a professional, he really felt there should be more out there to help families and struggling loved ones than just, in a sense, dying, which is the way he described what he witnessed for his mom and how she was with this. Why we talk about CRAFT? Well, it's a collaborative, supportive set of strategies in which family members can learn how to be and deal and cope and influence the thinking and decision-making of their loved one who have a substance use disorder. So it utilizes the power of the family. Key to all of this, the family has so much wisdom, data, and power and perspective. It can be a really, really useful context for change. And again, as we saw in an earlier slide, if family support and peer support's not there, treatment outcomes are worse. So it's interesting that we have that data, and sometimes we get the message that the family can't be part of the process of change. So it's just interesting how different messages evolve. The important thing here is it's also unilateral treatment, which goes back to 40%, 50% of the people with a substance use disorder don't want to stop. They're still going. And only 10% wind up going into treatment. So while we have family treatment programs, if the prerequisite is you're in treatment, we're going to miss a lot of people. So CRAFT is unilateral. It works with family members regardless if their loved one is in treatment or not. And in a lot of our clinics, we'll get parents and loved ones calling, and they don't know what to do, and their loved one is just not interested in seeking help. So CRAFT is really designed for that. It's got 3 specific goals. It's to help, the IP terminology here is identified patient, but it's to help family members have some influence so that the IP reduces their substance use if they're not seeking treatment, to increase the likelihood and look for moments where motivation is peaking so they can seek treatment. So the idea is to get them in to the care of a professional, and importantly, increase the life satisfaction of the family members while they're dealing with this. Okay. Just for data, this was one of the first studies, a randomized clinical trial with Bob Myers, Bill Miller et al. Out in New Mexico, and they wanted to test CRAFT against a couple other conditions out there. And what they did is they put out an advertisement for families saying, if you have a loved one who's got a substance use problem and they don't want help, we offer these services. Come on into our clinic, sign up for the trial. Family members came in. They were randomized to 1 of 3 conditions, an Al-Anon facilitation condition, a Johnson Institute's intervention condition, where you sit with the therapist over weeks. You'll script an intervention, sit down, and family members in a concerned but directive way will give feedback to the loved one with the idea of then striking while the iron's hot and getting someone into treatment. And then CRAFT, which was about a 12-week treatment program where family members met with the therapist and learned the skills that we'll go over. Caveat here, Al-Anon is kind of a straw person. Al-Anon doesn't suggest, and its purpose isn't to get people in training, into treatment, so this isn't a fair comparison. The reason why it was included in the study is just, it's the most often given advice to loved ones. So they just wanted to see what happens in that condition. And as you can see, generally by 6 months, CRAFT treatment engagement rates, that is the loved one actually made an appointment, went in for an intake appointment, and met with the counselor for at least 2 sessions, was double that of the intervention, and certainly spiked much greater than the Al-Anon facilitation. One thing to note about the Johnson intervention is that when the intervention was conducted, its success rates was just as good as CRAFT. Problem is, most families never got to the point of doing the intervention. They broke down, they had it, they couldn't implement it, or the intervention itself never occurred. So when we just think about not only acceptability, but feasibility, CRAFT seemed to be implemented easier for family members than the intervention. That study was just trying to get people into treatment. So again, that came from the premise of I have a loved one who doesn't want help, isn't interested in treatment. I would like to help them seek it, and the success rates were there. For treatment retention, there was a study among individuals who went to a detox for opiate dependence. They went inpatient, they went through a bupe detox, they remained in treatment, and their family members were invited to either 1 or 2 conditions. They would receive CRAFT training while their loved one was in treatment, or they went to a support group where they got psychoeducation about addiction and talked with other individuals who were struggling or had struggled with recovery. And these are about week 15. The CRAFT condition, and specifically it was the parent-parental relationship here. that when parents received CRAFT, at 100 days, the treatment retention rate was about 42% for the CRAFT-trained parents, that is, their loved ones, about 42% of them were still in treatment. For the psychoeducational group, the loved ones, the retention rate was about 10% after 15 weeks. And we know attrition rate is really high in addiction. So when family members and loved ones learn some of these skills, their loved ones seem to stay engaged in treatment longer. And if we just look at substance use outcomes, you look at the reverse direction, average weekly drug use was lower for those whose parents received CRAFT, as well as opiate use. So while CRAFT was developed to help individuals seek treatment, when it's implemented as kind of a support context for those who are in treatment, it also is a very useful way of creating that context that you saw a slide earlier about for increasing better outcomes. The other bunch of components that I'll talk about, and I just want to give a rationale for, is motivational interviewing. How many have heard of motivational interviewing? Yeah, it's been around for a long time. We roll it out over 20 years, but it's nice to see that it's making its way out in the world. And just briefly, there's a lot of evidence for it. It yields mild, about small to moderate effect sizes that most psychosocial interventions do. But there's over 200 randomized clinical trials for it. And when it's added to other treatments or when it's against just giving advice or no treatment at all, it shows significantly better outcomes. And the real encouraging thing here is most of the time, again, it's in the hands of clinicians, and we know, well, we've only seen 10%, but family members can learn motivational interviewing strategies. So again, taking it out of the hands of the clinician and allowing it to be brought into the home. And what I'm just showing you here is a study that was done in Scandinavia, and what they tried to do is teach family members whose children had a psychotic disorder. The children were in treatment, were on medications, but they were also smoking a lot of pot. And the families could receive one or two types of trainings, a psychoeducational support group training, and the other intervention was motivational interviewing. Parents learned how to use the OR skills that you'll hear about today, and in this afternoon, I believe, one of the presenters will talk about that. But just communication skills, how to talk, how to have conversations, how to listen for motivation. And what the slides are really showing and the target was cannabis use. When you look at families, the blue bar that learned motivational interviewing and interacted with their kids around that, the average amount of days of smoking pot significantly decreased in that group where the psychoeducational group didn't. Alcohol and other drug use was about equitable. And abstinence rates certainly was almost trending. They were close, but significantly higher to the families receiving motivational interviewing. And that's what FMI is. So the neat things about these as I go through is all this kind of information can be given to family members. They can learn and practice it in their household, motivational interviewing and CRAFT strategies, and it can make a difference. It can significantly increase the trajectory of outcome for those struggling with the substance use disorder. Give that away. I'm incorporating some of the slides that we've done for parent training, and just hopefully that you get to experience it a little bit too. So we are talking about perspective shifts. So I always ask people when you look at this, what do you see? I don't know what jumps out. This has been around the block a little bit, so you might know that. But what stands out to you? Anyone? Young woman, okay. And an old woman, right? People just see, who just sees one? Okay. Who can see two? All right. It's interesting. For those that can see two, is your mind just pulled to one first, and then you have to think and try to adjust to see the other one. So there's kind of a bias of just jumping in. That's what your mind grabs. And for others, and that's okay if you see one, how much work or effort does it take practice to see the other one, to kind of get that ability to shift perspectives? And if we sat here and talked about what feelings come up, what assumptions come up, each one would probably be associated with a whole different set of chatter and different evaluations. And we had the old lady with kind of her mouth there, and the shawl over, and maybe the glance of the young lady to the side. But a lot of what I'm going to talk about is perspective shifting. I can't argue here, and if we could spend probably the whole morning on who's right. Is it the old lady? Is it the young lady? Who's that? And we could spend a significant amount of time trying to argue who's right. What I'm talking about is more about perspective flexibility. And often the messages and the words that we get around addiction and others offer one perspective. And if we can gather another perspective, if we can help people just shift, by seeing it differently, it may offer some other possibilities that weren't there for them. Right? So this could be an argument in an office over a label for a long period of time. Right? And historically, it has been, and I've fallen into a trap sometimes in my own clinical work of trying to be on one side of that. But maybe I can step outside and say, if I can see your perspective and you can see mine, maybe we've got some flexibility here. So what are some of the key concepts? Not as being right or wrong, but as another perspective that we offer parents. These are really the highlights for that. A lot about behaviors making sense. We all sat here, we talked about the reinforcing aspects of substance use. There's a reason why substances are used. There's a reason why people invest a lot of time, energy, and take a lot of bumps and bruises to keep that as part of their life. So for parents, it's not that they're out to hurt you, to harm you, to make you piss you off, to attack you. There's another thing going in here. It makes sense. So how can we understand substance use? Because if we can see it as making sense for the person doing it, it takes away some of that bite as a family member when you're sitting there trying to be of help. Ambivalence is normal. Right? It's not necessarily denial. Ambivalence is a normal part of change, and it might actually, to see ambivalence might be encouraging. But let's make sense of that. If that's the normal part of change, we can have two voices about the same behavior. That voice can be on Monday and Tuesday, or you can sit with someone and you can hear them argue why they want to change, and then 10 minutes later, they can tell you why they don't want to change. And that can be maddening if you're a concerned loved one. But if we look at it as ambivalence, we can work with that in a way and help learn strategies to how do you respond to ambivalence when it shows up. Enabling, we try to talk about that and put it in a more nuanced context here. There are things you can do that can be helpful, and there are certainly actions that in the long run may not be helpful. Can we learn to differentiate that? But we don't want to use a big word to encompass all behaviors. We'll talk about light, that's communication strategies. One answer doesn't fit all. This is all the new perspective. There are multiple. Substance use is complex. That's why we can talk about it for days and hours and have summits about it and have workshops and look at it from every single level, from the political, the sociological, the psychological, and the biological levels. It's a very complex behavior. And for something so complex, one answer isn't going to address the problem. So let's think about it in terms of there are many roads to change. And epidemiologically, a lot of people find those roads without coming into contact with the treatment system. Not everybody, and there are people that struggle and need that structure, and we're there for it. But there are many roads to change. And we talk to parents about practice, practice, practice. Anything, treatment, any skill requires practice and effort. No one's an expert at any of this. And I always tell parents, I'm a father. I got more training on how to drive a car than I did on raising a child. I had to take driver's ed, I had to take a test, I had to sit in a car. When I showed up at the hospital, I just had to know how to put the car seat in and drive away when they took my son. So when I sit there and think, well, practice, practice, practice makes sense. Right? It's getting in there and doing it, and it's okay to not be good at that, and that can be empowering for families. You're not expected to be the expert here. You're here, you have it, let's try these new skills. So these ideas, compared to the traditional ideas, we'll jump into now. Craft, the underlying overall emphasis here is the use of positive reinforcement. Positive reinforcement to understand why substances are used, positive reinforcement to understand how the change process happens. And one thing I kind of think about, I'm a lousy gardener, and if I were to go in and say about, well, how do I grow flowers? I guess there's two perspectives I could have. I could focus on the flowers that I really want to grow and develop, and I should be concerned about the weeds when I see them going on. So I can be told one strategy is, you know what, you don't want to inadvertently water the weeds, so cut off all the water. You know what, don't water anything. That way, till those weeds are gone, when they're gone, you can start watering the flowers. This way you're not going to enable the weeds to grow. It's a safe strategy. I know I won't be enabling and growing the weeds, but I pay a price for cutting off all the water. Because what am I going to have left at the end of the day? Nice patch of dirt, maybe. I'm not going to get the flowers I want. I could go the other extreme, and I can water everything. Just pound it with water and say, you know what, if I put enough water on there, I'm going to have the great flowers, and hopefully they'll outgrow the weeds. But chances are for that, what usually happens? Right? Weeds are pretty good at growing fast. I'm going to do that. So how can I have a more nuanced approach? How can I... If positive reinforcement is the water, how can we teach parents to say, you know what, you want to water the stuff you want to grow, and let's be strategic and nuanced to make sure you're not inadvertently watering the weeds. It takes a little practice, takes a little discrimination, but you can do it. So positive reinforcement is not only helpful for understanding why someone is struggling with a substance use disorder, but it's also very helpful in the process of change. We want to grow the behaviors. We want to grow the portfolio you want to see. You have to be around for that, but you also want to be careful not to inadvertently strengthen the behaviors you don't. That ultimately, if you think about craft, is that's what they're helping loved ones learn. How to use reinforcement to strengthen the behaviors you want, how to not inadvertently use reinforcement, and that's where the word enabling is helpful, not inadvertently reinforcing the behaviors you don't want to get stronger. I don't know if people are into meditation, and I don't want to do this if as a consensus or not, but Kelly Wilson, anyone trained in ACT here? Heard of ACT? Okay. And I do this because it's just to give a sense. He's a psychologist who developed ACT, and he had a heroin addiction, and he's very open about that, and he struggled for years with addiction. And then wound up getting into graduate school and developing this therapy that's out there with Steve Hayes. And he offers a meditation to think about this idea of reinforcement from the perspective of the individual that's struggling with it. And I found it useful, and if you're okay with that, I could walk you through it. It maybe takes about 5 minutes. But it's a perspective exercise, and it's the idea that when we're sitting with someone, and a family member's sitting with someone, who they're seeing just in a sense, they feel it's destroying their life. What's it like from that person's perspective? And even for me as a practitioner, when I'm sitting with someone, seeing them engage in behaviors that from a distance seem really bad, and they're struggling there, what's that like? So if it's okay, I'm just going to go through this for about 5 minutes. I'm just going to ask if you want, you can close your eyes, you can look down, you can look at me. And I'm just going to read from something he wrote. And he said that there were a lot of times when he would often sit there, and he's like, if you're here, then you have contact with people who are struggling, sometimes really deeply, that are stuck, and from the outside you can look at that and you just say, what? And often from the inside, they are also looking at their own behavior and thinking, what is wrong with me? Why can't I stop? And as Kelly Wilson said, he said, I couldn't come up with any other thing except I was just broken. Right? So he developed this exercise to give you that sense, a glimpse into that feeling. Right? So I'm going to ask you just to let go of the agenda for the day. Notice the rise and fall of your own breath. And just let your breath kind of fall away softly. You feel your feet on the floor. And I want to invite you to think for a moment about something in your life that is sweet to you. You could picture something in your life, something you do, or a person in your life that swells your heart. Something that is sweet and beautiful to you. breathe and take a moment. Let yourself see an image of you engaging in whatever that sweetness is. It could be with someone you love or some activity that you love. And if you can conjure that image, just rotate it so you can look into your own face in one of those moments of engagement. See if you can look into your own eyes and into that face that has known that. Take a second, allow yourself just to be bathed in that sweet sensation, and breathe. Now I want you to imagine that some set of circumstances, you don't have to worry what they are, but some set of circumstances arise where you know that whatever it is that's sweet to you is killing you. And it's killing the people around you who you love. You realize it, you just know it. This is killing me and killing the people that I love. And imagine that you had to take one last look and say goodbye. Imagine you could just say, I'm so sorry, I have to go. I have to go. Take a moment just to allow all of that experience swirl around you. Allow all your awareness to return to your breath. When you're ready, just allow your eyes to come gently open and join me here. Just want to kind of read something that he said as a follow to that. He said, the thing I know about those days is that if I just got the right combination of drugs and just the right dose, I would get a moment, just a moment, where it was okay to be inside my own skin, where I could breathe. And so for some of the people you're sitting across from, when you ask them to let go of substances, you may be asking them to let go of the only peace that they have known in the world. And that longing for the moment where you can breathe, that moment of peace. They are not broken to want that. That's all what we want. The part that gets forgotten is the entirely human longing to be able to draw just one free breath. I don't know what that was like, for all of you. And I know it's a big room. But the idea of behaviors making sense, that idea, that reinforcement, that there's a purpose for it, is a powerful driver. And when we're working with a loved one, when we're asking people to work with someone to change, that often is the invitation we're asking them to take, to let that go. And to be able to create a context to help someone take that invitation and to stay with it is kind of the context that we are going to ask families and work with them to understand. And that's been useful for parents because and loved ones. It puts the behavior in a context. I find that a much more sometimes better message than this graph I put up, but certainly the idea that behavior is reinforced, it sticks around, and if behavior is not reinforced over time, it fades out. Reinforcement for an individual can vary, and certainly in the world of substances, there's powerful biological systems that are part of reinforcement that are activated by the drug. So drugs are good at what they do. they're timely, they're consistent, and they hit the reward system. And they're effective. One thing in the material that goes over with parents, just to give an example, this is a very big way, but this whole idea of functional analysis, and again, we'll have access for this, but even as a professional sitting down with the family member, and this is online, to sit with them and go through, put the behavior in context, let's understand it, what was going on before your loved one. So this is also asking family members just to take the perspective of their loved one struggling with it. When are they more likely to use? What are the circumstances? What could they be feeling? What are they getting out of it? What are some of the positive consequences? And what are some of the negative consequences that might be there? The neat thing about this is families have so much data. And sometimes they're often made to feel they don't know what's going on or their perspective isn't useful. But they have so much data. They see what sets the substance up. They can also predict a lot of times when it's going to happen. So just by thinking and working through with families on this, it gives some insight and strategies for how to either alter some of their reactions around the consequences or thinking about the triggers and situations that might increase the probability of use. The message never is families control the outcome here or to blame for it. It's that you have a wealth of information to understand it and just be strategic to try to influence what you can, and it influences the process. Which we talked about with enabling is that the idea here is positive reinforcement of something that you want to see and not reinforcing what you don't. That's enabling. Using positive reinforcement at all as being bad, that's not the nuanced approach of enabling we have here. A positive reinforcement can be really helpful. So that does imply the idea of not always detaching and stepping away. It's being strategically interactive. All right, so CRAFT helps family members learn how to strategically use positive reinforcement and strengthen positive behaviors. Water the flowers you want to grow. Be careful not to inadvertently put water on the weeds. And certainly use water because it's helpful at the end of the day. If you want a varied portfolio and beautiful garden, it's going to need some nourishment as well. I always found this funny. When we think about the human spirit of ambivalence, being two minds about something is quite normal, and it's a human condition and a struggle. It's not something that's bad. It's not something that's inadvertent. It's something that we expect. So this is one of the messages we talk to families about. How does ambivalence in your loved one shown? Okay? It's really about being of two minds and two perspectives. Bill Miller in Motivational Interviewing always talks about motivation or discussions about it as a pizza pie, and you've got two slices. You have the voice of change and you have the voice of staying the same. If I'm in a conversation with someone and I take the voice of change and I'm the argument for why things need to change, what slice of the pie have I left the person to take? There's only one position left for that person to take. And more often than not, they'll take it. So the trick in conversations, I shouldn't say trick, it's probably more of a strategy, is how can you have a conversation with someone and leave both sides of the pie on the plate so that they choose the one? Because if I'm the voice for change, more often than not, I'm going to get the voice for why they can't change back. And that's something we talk with families about. If you're hearing someone arguing why they need to keep doing it, then you just got to check in with yourself, and did you inadvertently just become the voice and took that argument away? You're now the voice of change. And motivational interviewing is all about how to have conversations that leave both positions on the table. So one response to ambivalence is telling people why it's important they change, what's going to happen if they don't, and how they should go about it. Other one is to engage in a particular way that invites the other person to think about what they could get by changing. But they're the voice of the change. Red lights, green lights here is just basically people, how sensitive are we to signals that the conversation's going well versus not. We talk and strategize about helping individuals and family members just pay attention to the signals that are in front of them. There are times when talk is going to be helpful and effective, and there are times when we just fall into a lot of traps. And you talk to family members, and they talk about the screaming arguments and the fighting and the distancing and how communication is not working for them. So we try to go back and just talk about being sensitive to signals out there when conversations are going to be most helpful for them. So I did all, again, this is all in the perspectives. And again, I just want to give you the assumptions coming from this model. There are numerous roads to change. What works for your neighbor is not going to work. Your neighbor's child may not work for your child. There are evidence-based strategies that are helpful, and they are, and we should pursue them. What evidence-based strategy, how and when, the context varies from person to person. So even though we have these set of guidelines, we try to work with family members just to say evidence-based doesn't mean it's going to be 100% right at this point in time. If not, there are other evidence-based strategies that are out there as well. Often people don't get that message, and a lot of parents and families come in saying they've been told that there's only one way they need to do this. And if it doesn't feel right to them, they won't do it, and they go underground. And we talked about practice, practice, practice. Sorry for the pace on this. I know the next speaker called Break is right after me, and that's an allure. So I want to be able to make sure I give you enough and a taste for this as a starting point. And I'll show you all these resources are out there as well. Helping with self-care. In this particular model and the material that you have, there's really 4 points that we talk and work with parents about. Let's normalize that this is stressful and validate that. This can suck the life out of you. It's a long journey, and for families, it just doesn't change overnight. We know what the relapse rates are. We know that it's a long haul. Right? So being in this long haul and just putting it out there can be really helpful. Because a lot of times when families are first hit with this, they often feel they'll get the answer, and the problem will go away right after that. And that's not usually the experience. So working with families on strategies, how to manage their emotions is really important. It's going to be stressful. There's going to be anger. No one goes into any of these interactions with their loved one as a blank slate. There's a lot of history behind it. So how can loved ones learn to deal with their own stress and anxiety and emotions that show up? Helping them manage their isolation. Which is really important, isolation, and that's where support groups are important. One of the things we're talking about is a parent-to-parent coaching. I can also give you that number. But breaking isolation is huge. I've met so many families that felt so alone and so isolated, and they've sat with that for years because there's just a lot of stigma and shame associated with that. And that's what that last point is about, how family members can deal with their own feelings of shame, feelings of failure, being told, well, if you did your job right, your loved one wouldn't be struggling with this problem, your kid wouldn't have that, and the torturous chatter that they sit with every day. So self-care is huge. It is such an important piece of working with family members, and it's certainly a great message to talk to family members about and give them permission to do it, because that's the other thing. A lot of them feel they can't have permission to do that if their loved one is on fire. So it's not just saying be happy, which we're certainly not saying that, or drop your problems or forget your problems. It's how can you work, keep yourself nourished, connected to the important things that you value as a parent, as a loved one, in the process of taking this long journey. There was a video out there, a professor, someone was talking about, they were holding a glass of water, and they asked someone, how much does the water weigh? I don't know if anyone's heard this, and the class came back, 8 ounces, 6 ounces, and that, how full, and her response was, actually, the weight doesn't matter. The real question is how long I hold it. If I hold it for just 60 seconds, it feels very light to me. If I hold that glass of water for 5-6 hours, my arm's going to start to get tired and fatigued. If I hold that glass of water for 24 hours straight, my arm's going to feel paralyzed. So that's something we invite parents to think about. You're holding this for a long time. Right? So if self-care isn't part of this, you're going to feel paralyzed. Right? And you have permission, and let's think out loud together what you can do for support. That could be going to a support group, that could be getting back to activities, giving yourself permission to do something that feels nourishing. And I said, you'll have all the slides on that. It's just a lot. It's probably crushing by PowerPoint. But helping with words in that bucket, here are just the skills that we go over. And we have, I'll show you where you can get worksheets and books, and stuff's free online for this. The major components are listening skills, how to offer information when you do want to have conversations or provide information, the importance of validating and empathizing, and the 7 elements of positive communication, which comes from CRAFT, which is when you want to have a difficult conversation and you have requests of your loved one, what are the ingredients that go into a conversation that are more likely to be helpful? So we'll sit with people and script out conversations and practice them before using these 7 steps, which I'll outline in a minute. The whole idea of all the communication is there's a lot of traps out there when we talk. These are just some of them. The information trap, if they only had the right amount of knowledge, and if I could just give them the right information, that's going to make things different. Information's really helpful. It's useful. We need it. It may not necessarily be the thing that's going to make change. So just can use it, red and green lights, provide it, but how's the person responding to that? If they're tuning you out and they're not listening or they seem far away, that's a red light. That, in that moment in time, information might not be working. But if we take it up a notch and start lecturing, if I just make the information louder and more forceful, that will work. And talk at them, maybe that. And we tend to lose people. That's just taking that side of the argument off the table. Right? So that can be another trap we can fall into. We talked about labels and taking sides. If we're getting arguments for why the person doesn't want to change back, we've probably inadvertently taken a side here. And our question and answer trap, which professionals can get. If I ask you the right question, I get the right information, I can give you back the right answer. And sometimes that happens. It also puts a burden on us. We got to come up with the right questions. We got to think through, and hopefully we get the right answer. So again, none of these are bad, and they're all helpful. It's just being sensitive to, are they working right now? And if they're not, how can we be flexible to kind of put it and come at it from a different angle? Is there, Jeremy's, he helps me out here because it doesn't.
Positive communication strategies that people learn in CRAFT are helpful on so many fronts.
At first, communicating in a healthy way was kind of difficult.
It's very tough to listen when your child is using substances.
A big part of engaging is not doing all the talking, it's listening. It's really, really listening.
Repeating back to somebody what they have said or rephrasing it so that you're certain you understand what they're saying, that person really feels like they're being heard and they feel like they're being understood.
It's really about trying to put yourself more in their shoes. Where are they coming from?
Knowing when just really to be there and listen really changed the whole feel of our home.
Sometimes all you have to do is listen.
These are collaborators for that. Just background for the people that are on here are actually parents in the Parent-to-Parent Coaching Network. That's a free service countrywide. Parents can call up, talk to other parents. And they've kind of learned these skills and put it in, you know, the children that talked are their children who were struggling as well. So I just think they have a better voice sometimes than anyone else because they've been there. When we talk about listening skills, and I think you'll get a dose of this later on today as well, so one of the speakers will talk about, this is right out of MI. Really, if you're doing motivational interviewing, besides the stance and the perspective we bring, these are the skills you really have. I'm a psychologist, and I always think the one skill I have is I talk. Right? So if conversations are going to be helpful, hopefully I hope they are, because that's what I'm doing all day. And spent lots of years to be able to do. So if they are work and they help, what makes them the most effective? How can we refine them? So motivational interviewing is really about when they're pulling apart, what kind of conversation and what are the ingredients? So what we talk about and really work with family, and that study with the cannabis use is this is how they were teaching parents just to converse. How do you use open-ended questions? How can you use affirmations? There was a study looking at therapy sessions, and they looked just at what therapists say and how do people respond to it. And when they talk about change talk, which MI tries to increase, it was after affirmations. When the therapist affirmed something positive that an individual did and was able to highlight that for the individual, change talk spiked. The person was much more to talk about what they wanted to do differently than other strategies. So we work with parents on affirming, and that can be really tough because there can be so much wreckage and bad feelings and destruction out there that finding what's going right is a challenge. But if we can, and parents can approach that, it changes the whole dynamic of the conversation. And it doesn't always make them the bad guy, which being a signal of badness is not helpful. So it gives parents also a way of being able to engage and affirm. We talk about reflective listening and summary statements. Those are the bulk of the listening skills from MI that we teach parents. Reason being is closed questions usually have yes or no. They shut conversations down. Open questions invite collaboration. MI is about pulling out, not putting in. And that's really the difference is if a person's ambivalent, they've got reasons why they want things to be different. Let's try to pull that out of them. My job, I don't need to necessarily put those reasons in. Open questions bring that out. Affirmations, we said, are just catching people being good. And by doing that, it changes the dynamic of a conversation, can help reinforce the behaviors that you'd like to help grow, and helps parents and family members get a different perspective. They're looking out for different things. When there's scary stuff going on, you're going to want to look out for the danger signals and what's not going. That makes total sense. And that sense of vigilance, again, there's a reason for it, but what it happens is it narrows the perspective. And this is just an invitation to work with people to broaden the perspective. See all that the person is doing. Change is going to come from what's going right in the traction. Again, it's not meaning ignoring, and there's nothing I'm going to say here that means you can't talk about the dangerous behavior, and we don't suggest that to parents. What we're trying to do is just make things more flexible and often turn around the dynamics that are going on, which haven't been helpful up to this point. And it should be specific. It shouldn't be, oh, what a great job. It could be, I really liked the way you came home on time last night. You know, I really appreciated the way you listened to me. So we ask parents to kind of get specific to the behavior, specific to what they observe, and it gives a nice blueprint for the other individual that they can succeed at stuff. You said that big prize of changing takes a long time. Reflections are just statements back. Sometimes I had a parent we were talking to whose child used to say very provocative things, just to freak her out. And she would get engaged in a lot of discussion. How can you say that? What are you doing? And it became this big battle. And one thing she started trying is just reflective listening. I'm going to go out and get high tonight. The thing you want to do tonight is, drugs are the most important thing for you to do tonight. That would be a reflection. It's uncomfortable to say that, but when the child heard themselves back, they would correct often. There was no fighting, and that gift of hearing themselves talk changed the dynamics. So reflective listening she found extremely useful. Just took the pressure off having to convince and argue. And often she got more change in perspective from her child because he didn't like what he was saying when he heard it back to him. And it wasn't yelling, it's just a way of matter-of-factly just giving back a person what you hear them saying. MI uses it exclusively. It's a very powerful part of MI. Parents can learn how to do this, and it can really change the dynamics of conversations. I'll show you where you can get worksheets. We have worksheets we sit with parents and just talk about statements their child may say, what they might be pulled to say, and then how can they practice a reflective response. And again, this is just in the course of interactions. Your practice may set you up to do that, but it doesn't have to be a long, overarching practice. It's just kind of the introduction to the topic and things that they can also try on their own. And summaries are really just collections of material. Offering advice. Advice can be really helpful. We're more likely to benefit when we give it when the person wants to hear it. And they may be ambivalent about wanting to hear it, but what we try to train people to talk about is how do you offer advice if you want to in a way that you might get a little bit more buy-in. So we kind of talk about offering information or the offering sandwich. And Steve Rolnick talks about it as ask, provide, ask. Some people may have heard that. He works in hospitals a lot. But basically, you want to get buy-in first. So we talk about just getting a green light to say what you want. So we kind of say it's the top of the sandwich, this information sandwich. And it does give person autonomy. It's a collaborative spirit. It could be just to start off a conversation. Would it be helpful for you to hear about X? Oh, let me know if this would be helpful. Would it be all right if I ask a question now? Could I offer a thought? Would it be all right if I express one concern I have about your plan? You know, it doesn't mean I necessarily agree with what you're doing, and I might have concerns, but would it be all right if I share that? People say yes. Actually, just asking that sometimes takes people off guard. Like, first time someone asked me if a doctor can give me information, and people feel weird about that in my office sometimes. But it does open and it's collaborative, and if they say yes, I proceed. The trick here is if someone says no, you kind of got to honor that. So I would just say don't use the strategy if you're not willing. If the person says, you know what, I would rather not hear that right now, then we're in a position we have to respect that at this point in time. Because if not, then the next time it's used, it's really not going to be as effective. Then providing information, the middle of the sandwich can be anything. It could be feedback, it could be information. And when we talk with parent coaches, it could be their own self-disclosure. You know, any information given with options can be helpful. And then the important part is just checking back in with the person. Was that helpful? How do you see that being applied to your situation? What are your thoughts about what I just said? Just coming around to make sure that what we offered and what we provided helped. This 7 steps of positive communication really is from Craft. It's a way how to script requests, and it really came from the fact that if nagging, pleading, threatening, yelling, lecturing, throwing substances out when you go through the drawers and you find them in your loved one's possessions, if they were working, no one would be coming to talk to us, because people have tried a lot of different things before they get to the point of actually saying something's going on. And someone had told me that when that person in your office is going to ask your advice about how to handle that, it's a real problem now. It's hit them that this is real. Because there's a lot of time beforehand where there's different strategies that families use. Maybe I shouldn't be concerned about this. Maybe this is a passing fad. So they sit in their own world with that. But when that advice and that question comes out, now it's real for them. And probably they've tried all this stuff already. So what are the 7 steps? And again, this is something we just sit down or we ask parents to think about. If you've got a request, it should focus on the behavior. You know, I'd like you to be home on Friday nights. Now, the more specific, the better. It shouldn't be a conversation that brings up all the past issues. You'll go off the rails there, and it can be a lot of emotional charging in that, but it's not going to be helpful. It should be described as positive. I always think about the sleeping man rule we talk about. If you're defining a goal that a sleeping person can accomplish, it's not worded in the positive. I don't want you to do X. When we word things about what behaviors we don't want to see, that's hard, because what we're not defining for the person is the blueprint of what we want to see. So we work with parents to say, understand where the concerns are, but if you don't want to see that behavior, what behavior would you like to see? And let's make the request about that. Feeling statements, what's the emotional impact it's having on you as part of that? If we can offer an understanding statement, that buys a lot. I know you've been trying really hard over the last several weeks and things haven't been going well. And it really scares me when I see that you're starting to pick back up and we're close to that relapse. So they are labeling feelings and trying to at least acknowledge something about the other person's perspective. And if there's some responsibility, doesn't mean own the problem, but if there's buy-in and sharing it and collaborating, these kind of ingredients, when people script a conversation, and it is scripted, I mean, at times that's helpful. We'll sit and just work. Practice, practice, practice. You know, you're going to step into this conversation, probably of having had this conversation dozens of times and it just didn't go right. And all that's going to be part of what you have when you go into that. So let's think creatively and write it out and practice it and think about it and then go in and try it out. And again, timing, tone, practice ahead of time, all important. Red lights and green lights. Pick the time that it's going to work. If my son's coming home and he's got a buzz on and it's Friday night and he's an hour late and I've been getting pissed for most of the night because it's not happening and no texts are being answered, not probably the best time to have that conversation about what I want to see happen. So not that I have to engage in that, but I should step aside and let's pick a better time where it can be more effective for you. Helping with actions is the fourth part of this. So what we've talked about is the importance of understanding. Let's give a separate set of lenses for people to understand the behavior. So there's a different context for making sense of what they see. Behaviors make sense. Reinforcement's important. Ambivalence is part of change. It's a long journeys. Self-care is really vital as a family member to stay connected and not feel isolated. Get support. And don't lose sight of what's of value and try to move in that direction. Helping with words is the conversations. Change does follow conversations. Words can be really helpful. We swim in a sea of that. We saw that with the labels where words can be imprisoning. Words can also help people think and want to make change. So let's just use conversations and conversational skills that can change the dynamic there. And then the behavioral influence strategies that come from craft is this fourth dimension, which is helping with actions. And we spend a lot of time on that. These topics and helping with actions to get you to think. One is helping people just think through the steps of problem solving. A lot of these are overwhelming. By the time someone feels that they want to talk to you as a healthcare professional, they're stressed, they're probably feeling overwhelmed and don't even know where to start. So helping solve a problem, so it's just a bunch of steps to narrow the problems down. And where can you start? What are the things you'd like to see different? How can you define that? Because most of the times the problems we'll get as healthcare professionals are the big ones. Right? So it's just trying to step back and help people think through what are the things they'd like to see different. Parent collaboration is huge. More often than not, there's not. And if I ask you percentage-wise, we had this helpline parents call. Who do you think is the one most often calling the helpline for help? Mother, right. And if you look at all these craft studies, wives and mothers, probably 90% of the people that are reaching out for help. Dads, maybe 10, 5. Not that dads don't care. Dads have their own way of dealing and handling with this, but it's the mother, it's the wife that is coming out and the one that often is seeking help with this problem. So being on the same page is really useful because when we talk about natural consequences and positive reinforcement and limit setting, if parents aren't on the same page, that can get complicated and the effectiveness can kind of really be decreased. So those are conversations and things to think about. How is your spouse on this? How is your partner on that? Do you and your partner see the problem the same way? How does your partner deal with this? What's been their strategy? So another important topic to think about and work with. We do. And we'll talk about reinforcement. So I'll quickly just go through this, and again, I'll give you resources. This is just basically the steps of problem solving. We probably all use it in our lives in different venues and different avenues and in different ways. They tend to get lost when it comes to really emotionally charged situations and matters of love and concern. So we try to kind of bring it back and sit with someone and just walk through it. And it's really just thinking about how to define a problem, select it, come up and brainstorm about strategies. Since there is no one road, brainstorming can be really useful, and think about how they may want to implement that. Okay? When I jump into positive reinforcement and natural consequences and limit setting, that first step needs to be really fleshed out, which is what's the behavior you're going to want to influence and look for. Because if that's not well defined, then using any of these strategies isn't really going to be helpful. If I can't see the flower, and I don't know what flower I'm looking for to water, I'm going to probably be using more of a gunshot approach. I want to be able to, as best as I can, say this is where I'd like to grow and water. So again, positive reinforcement not only is it great for understanding drug use and what we're asking people to go, it's a core strategy and help because we want to reinforce the behaviors we want to see. And that's really, if there's one fundamental message in craft, is reinforce the behaviors you want to strengthen. They're not going to get strengthened on their own. And for someone changing, particularly if they've gone into rehab and they've come out and they're coming back to the world, the reinforcement schedule is going to be pretty thin. So can we fill it in? Can we help them get traction? Saying no to their friends probably doesn't feel good. Having to find a whole new social support system is really hard. Making friends is hard. Now they've got to drop a lifestyle that they knew. And that is important steps, and reinforcement can help catch those steps and just strengthen them. It's not just being nice, it's a very behavioral, strategic thing, is we want to increase the probability of a behavior. Positive opposites is what it's trying to grow. Again, if we're asking someone to take something out of their portfolio, which they can never really do, but if we want to suppress it in their portfolio, we would like something else to be in its place. So we want competing reinforces, and that's a notion a lot in a lot of the lab studies and others we've talked about. But competing reinforces is used. It's well empirical process. Insider tips, reinforcement is best when it's after, not before. That's really key. People tend to lose sight of this. I don't want you drinking, so I'll do X for you. Well, it might be better to catch the person succeeding and then implementing the reinforcement. Sometimes the timing can get off, and if we're reinforcing behaviors before they start, that kind of falls into bribery, some people think, and others, but it's important to talk to parents about how to do that. That reinforcement's in the eyes of the beholder. Say I'm a child of 70s music and stuff. I went home and told my son he can have Led Zeppelin 2 album. When he finishes something, he probably would leave it on the table and walk away. He would want to hear Eminem or something else. We have to think about what's reinforcing for the given individual, and that's not always obvious. And sometimes as a parent, and we train parents, it's hard because they don't necessarily find it reinforcing for themselves, but that's key. And consistent and timely. And that's what I just want to put, that's what we're competing with drugs. Right? Drugs are consistent and they're timely and they're strong. The subjective effect or your nervous system letting you know that you've taken a drug is pretty quick. And most often than not, it's every time you do it, it's there. So if someone's reducing that and we're putting competing reinforcers in, it would be good if the competing reinforcers are also consistent and timely. Then at least we're on the same page with that. And they need to be doable for a person. We don't train or ask parents to do things that they can't do. And did I miss the sign? I probably did. You probably had it up for like the last 10 minutes. I'm sorry. One last thing here is just the idea of reducing negative behaviors is part of this model. We're not asking, reinforcement's really helpful, but there are times where you want the world to be a natural teacher. So the idea of allowing for natural consequences and sitting with the parent and thinking through, what are you willing to allow to happen if the person is using substances? The other idea of enabling is people block that. If your child was out drinking last night or was using drugs last night and they're oversleeping for school, are you willing, or is it okay to not wake them up? If that means they might get thrown off a team or they're going to get suspended. So letting the world's consequences for the behavior is a really important part of this model. And again, it's not always so straightforward, but having and inviting parents to think about and family members to think about what can you allow your loved one experience when they're engaging in the behavior. And every parent's different, and there's no clear-cut answer in that. But if you're protecting them from experience, and that could be a family member whose husband drank, and there was one where he would be passed out on the bottom of the steps and the kids would be coming down for school. And for a while, there was a discussion that I don't want my kids to see dad like that or their father like that. So we'd wake him up, call the office. Now, that's a tough decision. But for that particular person, they let that happen once or twice. And the kids would ask their father, why were you sleeping down on the floor? And for him to hear that and experience that was extremely uncomfortable. And now that was an outcome of what he was doing. So in that moment, the world was a teaching moment. And it was very uncomfortable for the spouse to allow that to happen. And again, it's something that's talked about and negotiated. But natural consequences is a useful part of this process, and Kraft talks about that as well. And your consequences is just setting limits. And usually for parents with children, that can be just discussions about if something happens, this is what, you'll lose access to a positive reinforcer. You may lose access to your phone. You may lose access to your car. But it's communicating it, not in a yelling, screaming way, but it's a very thought out kind of set of contingencies, and consistency and timeliness are important to do that. And I'll end with this, Jeremy.
Naturally occurring consequences are the consequences that are direct result of your child's substance use. What parents end up doing inadvertently is kind of protecting their child from some of those consequences.
As parents, we want to fix things and we want to make things easy for our child. We don't want to see them suffer. And by doing that, we are promoting the behavior that we want to change.
My parents allowed me to face the natural consequences of using. That was one of the most important things that helped me get clean.
When you do that, you stop feeling like you have to accept all the consequences of his behavior. He has to take the consequences for what he chooses to do.
If we suspect Caroline has used something the night before, then I will not wake her up the next morning to go to work.
It's all about helping parents figure out what are the naturally occurring consequences that I can actually let my child feel in the real world and let the world be their teacher.
Just one thing, we call it raising the bottom, right? When we think about hitting rock bottom, what we're saying is the natural consequences and the consequences of use, at some point, there's a tipping balance. The idea of thinking about it strategically, setting limits, allowing for natural consequences, using positive reinforcement raises the bottom. Often what we're saying is the decision process to change can happen a little bit more quickly than totally pulling away and just waiting for the world to somehow tip the balance for the individual. So again, the strength of families as a package here, because they see what's going on, can be really useful for not only promoting or inviting change, but also helping and supporting people when they are making that change. I have the slides there. If you can access them, you'll see websites. If anyone's struggling and they're a parent who wants to talk to another parent, this is a free parent-to-parent coaching service. They can talk for up to 5 calls to another parent to talk about this. The parents have also gone through some training in this material and can offer suggestions. But the power of that also is speaking to someone who's been down that road, and that's invaluable in this. There are websites that you'll also have on there. Craft Online for parents, that's a pay thing. Not all parents can do that, but there is something online if parents don't want to get craft training. NIDR and Treatment Research Institute has tons of resources for families as well, if someone's just asking for some guidance. The book that Bob Myers puts out is that's how to get your loved ones sober, but that's for parents to just read or loved ones to read on their own. and do these skills. This is for practitioners. This is the craft approach. Some of my colleagues had talked about craft, and that's in their book, Beyond Addiction. And this 20-minute guide is free online, the 20minuteguide.com. All these stuff that I showed you here, the skills, the worksheets are free. So for any parent who just wants to kind of think about this stuff, they can go on the 20minuteguide.com, can download the PDFs, can download the services, can even bring it back if in your practice you want to sit down and discuss these concepts with people. It's free online. Thank you so much for your attention and letting me kind of go into the break. But